Hi, my name is Jessica Meyer, and I'm presenting to you my practicum on the lack of the patient-centered medical home model, which can cause mixed vaccinations and the spread of disease on the island of Oahu. On the next slide, you can see that the reason why I decided to focus on missed vaccinations was because I wanted to create awareness within our clinic how us not conducting the PCMH model can cause the spread of disease, which is a public health issue. I also wanted to increase the vaccination rate at Schofield Barracks because I noticed that our rates were very low and I wanted to make an impact within our facility. Also, finally, in regards to the public health issue that my practicum is focusing on, is to decrease the spread of disease within the island. It's very easy to spread disease on a small island where tourists come and visit, so I really wanted to pay some focus to this. On the next slide, you can see I've set up my practicum by using tracers that were conducted within the family medicine clinic, the Schofield Barracks clinic, at pediatrics, and within our parent facility at the Tripler Army Medical Center, in order to better understand the processes and procedures of how the model is conducted at each location. I was able to meet with the medical director of PCMH and discuss why we conduct these processes. And I was also able to attend a phase 2 planning meeting in order to discuss how new construction was going to be designed within the facility to better help our customers and our patients in order to receive these immunizations. I also sat down with the immunization sergeant and had an interview with him to discuss the procedures, data that they have, and reasons why patients miss vaccinations. Then I conducted research on reasons why people choose not to vaccinate their children. I used peer-reviewed medical journals to conduct my research and to gather more information. And then finally, I met with the Army Public Health Nursing Supervisor and had an interview in order to discuss the vaccination or the impact of non-vaccination within the clinic, within military bases, within the island. And then I also was able to better understand how they control infection and the spread of disease within the island of Oahu and within the military base. On the next slide, you can see the accomplishments that I was able to perform through my design of my practicum. So I traced family medicine and I was able to better understand how they conduct the PCMH model. What I found out was that they do not conduct point of care immunizations, and so that is when they receive immunizations within the exam room. So these patients were being sent to an immunization clinic that was farther away. The same went with the pediatric patient that I followed, where they were 4 buildings away and they had to walk all the way down to the immunization clinic and wait in a long line, and the parent decided to skip it and come back, which can cause missed immunizations. When I went to the parent facility, I was able to see fully what a PCMH model is and how it's conducted, and these patients received point of care immunizations within their exam. When I met with the medical director, I was asking why they don't conduct the PCMH model, and he explained to me that because staffing is low and the way that the building is designed, it's not effective for these activities. In the phase 2 planning of the facility, I was able to assist with the design of the facility in order to have more space for immunizations within the patient-centered medical home. That way we can conduct point of care services. When I met with the immunization sergeant, I just realized that it's such a small area where they conduct immunizations and it can get really crowded. The hours of operation are very sporadic and not adequate to the needs of the patients, and it's far away from the pediatric clinic. I also was able to look at their data, and patients were unaware of what types of vaccinations their children needed, which could cause people to miss vaccinations. Also, the handouts that they have are very different from facility to facility, so this can be confusing. And then I did find out that the brand of immunizations that they purchase is based on logistic orders, supply, and funding, so it can vary from different military treatment facilities. Also, military family members move every 3 years, and with the stress of moving, patients can forget to get certain immunizations. There's other various reasons, different branches of service where they receive medical care. They just entered the insurance called TRICARE, so they don't have an adequate record of their immunizations. There's different schedules at different military treatment facilities. And then I also met with the population health nurse. He showed me this really cool tool that they use to determine what patients of the day need vaccinations and exactly what vaccinations are needed. That's the picture shown above. On the next slide, you can see some other accomplishments, some reasons for non-vaccination. People were worried about the ingredients, marketing schemes, new child immune systems, they don't feel like there was enough testing on vaccinations. So there's some high reasons why people decide not to get their children vaccinated, but it can harm other children and still cause the spread of disease on the island of Oahu. Another one that stood out to me was religion. So this can cause high vulnerability to highly contagious diseases and can spread disease to others. So the impact of misvaccinations, it can cause a patient to contact a deadly disease and spread it to others. The rate is higher on the island of Oahu because there's a high tourist exposure, because people travel around the island to explore and everybody's touching everything. One example of this is a child contracted pertussis within our facility because they weren't vaccinated, and the parents think that they got this from when they were at a highly visited tourist area and somebody had pertussis. So the patient came into the facility with pertussis, and then all of the patients who were within the facility at the time had to be called and tested along with the employees as well. This influenced me to go meet with infection control and see how they control the spread of disease within our facility, within the military base, and within the island. They collect data. So they contact the patient who had the disease, the provider, the clinic or area where it was recognized, and gather all the information possible, including who was all exposed. So the picture that you see here is how the data is collected and analyzed. When it's analyzed, they add information into a database to determine if it's an epidemic or just a one-time case. They also monitor this data across all military bases and within the location of where it is, so like the island of Oahu, per se. In order to control infection, the Army Public Health Nursing also educates our community on like how to control the spread of disease within their clinic or within their facility. How to prevent it, how to report it, and then they discuss the importance of vaccinations. On the next slide, you can see my recommendations. I felt that regular training is needed for the LPNs and the medics within the immunizations. That way they can conduct point of care immunizations faster and effectively. I also felt that monitoring and reporting HEDIS measures using the tool that was found from the population health nurse determine which patients of the day need immunizations was effective, because we can inform the patients that they do need certain immunizations and we can send them to the immunization clinic, because some people aren't aware. I also felt that continuous education within the community is highly recommended, because the more you know about controlling infectious disease, the more we can stop and prevent the spread of the disease within the island. I also kind of want to recommend a immunization rodeo where we open up like an influenza vaccination rodeo to kind of get a majority of the patients within the military post at one time. That way it can be conducted in a large group, no waiting, no hours, anything like that. And finally, I think a small step and a quick win is something that we could do is by conducting point of care with the influenza vaccination within the exam room. And this would prevent the spread of the flu, which is highly contagious within the island of Oahu. On the next slide, you can see my references for this project. Thank you for listening.